Thank you, Madam Chair. Good afternoon. My name is Dr. Leonie Herx, and I'm the immediate past president of the Canadian Society of Palliative Care Physicians, Division Chair and Associate Professor of Palliative Medicine at Queen's University, and an advisor to the Vulnerable Persons Standard. Today, I'm speaking to you on behalf of the Canadian Society of Palliative Care Physicians. Palliative care focuses on improving the quality of life and symptom management for those living with life-threatening conditions and their families. It does not intentionally end life and is internationally recognized as a practice distinct from MAiD. We are very concerned that the proposed changes under Bill C-7 may negatively impact patient care. Current MAiD safeguards are being removed in Bill C-7 when Canada has not yet had a thorough review of the current system. A new report in the Canadian Journal of Bioethics published this month concludes that the Canadian MAiD program has failed to provide Canadians with evidence to show that it is operating as mandated by the requirements of law, regulations, and expectations of all stakeholders. Gaps in the Canadian monitoring system have also been outlined in an April 2020 World Medical Journal and in the Vulnerable Persons Standard Report submitted to the House Justice Committee. We oppose the removal of the 10-day reflection period. Assertions that requests for MAiD only occur after careful consideration do not reflect our clinical experience. Desire for death and requests for MAiD are often expressions of grief, anger, loss, and despair as a response to a devastating diagnosis or a change in condition. This lament, a cry for help, now often results in a MAiD consult even before palliative care has been involved. Dr. Harvey Chochinow's published work in Psychiatry and Palliative Care demonstrates that desire to die in the terminally ill fluctuates and often dissipates within 2 weeks. The 10-day reflection period strikes an important balance, allowing MAiD to be requested while protecting people who may go on to change their minds and live weeks, months, or even years more. Bill C-7 proposes a second track for MAiD with a 90-day assessment period to end life for those with chronic illness and disability. More time is needed for careful assessment, access to experts, and to assess therapeutic effectiveness. Specialist care such as psychiatry, chronic pain, and rehabilitation medicine may take more than 90 days to access and see improvements. In most cases of suicidality in chronic disease, the wish to die resolves over a 3 to 24-month period. In other international jurisdictions that allow MAiD outside the end-of-life context, the law explicitly states that MAiD must be a last resort and that healthcare providers must agree that no reasonable treatment options exist. MAiD should not be a solution to lack of access to care. Recent media reports have documented Canadians who have requested MAiD due to loneliness, depression, social deprivation, and lack of supports needed for living. The COVID-19 pandemic has amplified these problems. Bill C-7 places MAiD as part of good medical care. Some suggest that this means MAiD needs to be introduced to patients alongside all therapeutic options. But MAiD is not just another option. It's irreversible. It has significant ethical and professional implications. If a doctor introduces MAiD, this may be all the push that is needed to nudge a person to pursue it. In other jurisdictions where MAiD is legal, this risk of influence has been addressed directly in the legislation. For example, in Victoria, Australia, their legislation explicitly states that MAiD discussions must only be initiated by patients and healthcare practitioners must not bring up MAiD. The Justice Committee heard many examples of Canadians who felt pressured to pursue MAiD, including the first-hand testimony of Mr. Roger Foley. Expected physician participation in MAiD in Canada far exceeds that of any other permissive jurisdiction in the world. Physicians who do not wish to participate directly or indirectly in MAiD should have their freedom of conscience protected. Conscience protection is supported by the World Medical Association, the Canadian Medical Association, and the Ontario Medical Association. Amending Bill C-7 to clarify and strengthen the conscience clause in C-14 is extremely important. Finally, we assert that the lack of access to palliative care in Canada is a national tragedy. A study by Monroe et al. In November 2020 examined palliative care involvement in patients requesting MAiD and found it to be wholly inadequate. In this study, 2/3 of patients had no community palliative care physician and 40% had no palliative care involvement prior to requesting MAiD. Without access to high-quality palliative care in a timely manner, patients who are suffering may believe that MAiD is their only option. Palliative care must be prioritized as an essential service under the Canada Health Act and adequately funded from coast to coast so that all Canadians may receive impeccable care and be able to live well until they die. Thank you.